Oh, I'm doing it now, but okay.
Well, hello everybody. I'm Craig Robinson. I'm the director at Cabin Creek Health Systems, and I'm here today with Dr. Jim Binder. Jim is a pediatrician and a psychiatrist that works here at Cabin Creek, and he's had a special interest in involving patients or involving families in patient care. And I wanted to ask Jim about his approach to this and how it might relate to the kinds of common problems that primary care providers and clinicians are facing from day to day. Dr. Binder, welcome.
Well, thank you. It's good to be here, Craig.
Could you tell us a little bit about how you got started in this business of involving families in medical care?
I think just from the nature of pediatrics, and 90-some percentage of visits family members are included. And I remember when I was doing my pediatric residency a number of years ago in the Bronx, and it was a large part of the Hispanic population, and it was actually lots of fun. But some of the time, the parents wouldn't be able to speak English, and there was not always translators available in New York Hospital. So the kids would be translating, and they were just sort of delightful and fun, and so I started to get interest in that. But then as I practiced in the 80s here in primary care, I find that primary care is really a mix of physical and emotional issues, and you can't really deal with emotional issues without involving the family and pediatrics. So that's probably where my interest came from.
And I know you've also written books about patient interaction or interacting with patients, interviewing patients. That seems to be kind of a related area to this family engagement part of your work.
Yeah, I think there are certain basic approaches and skills that are helpful in engaging families and helping to use their power to move patients in a positive way.
Well, it seems like from our conversations previously and just watching you in meetings where we've discussed cases that this idea of involving the family can be useful for a whole range of medical problems. And I know that we're familiar with involving parents certainly in children's care or involving the children in their elderly parents' care, but it seems like it even goes beyond that. So is that true that just about for a lot of serious medical problems that family engagement can make sense or can contribute to the care?
Oh, absolutely, Craig, for a couple of reasons. One is that if I'm in a family and I'm sick, it's going to have a very significant impact on every member of that family, for one thing, and they're going to have feelings related to that, often big feelings that we can help them with. But in addition, it's really like a cycle. Family members impact how I manage my illness, not just pediatric, but at any age. Spouses, young adults that are spouses, or as middle-aged, have tremendous impact upon whether I make a lifestyle change, how I deal with my diabetes, my attitude about medication, how I manage a depression. And sometimes family members are actually part of the issue of how I, what my healthcare problem is. And even more than that, though, Susan McDaniel and her group in Rochester probably have written about this extensively, and they recommend including them in routine visits, at least twice in OB care, early and then later before delivery. In pediatric care, whenever you have a functional illness, any type of psychosocial problem. So it's recommended even in routine care, not just when there's a complex or chronic care issue.
Well, I can see that for sure a diabetic, if you're caring for a diabetic, you would want to have the person who's doing the cooking in the room at some point. And what other kinds of situations come up where, or in what other ways can the family be of assistance to you as a physician caring for a patient that's in a situation where they're not doing particularly well, they're not controlling their chronic
Yeah.
issues very well?
Well, you have to explore that, but it could be as simple as giving you information that you didn't have. That might be very important in managing a child. So sometimes it's just information gathering. It could be how the family
It gives you another way to look at the patient's situation, to have the family.
Absolutely. I mean, there was one study done out of Baltimore with folks with hypertension. It was African American population, women more than men, and they did a really wonderful study. And I don't want to talk about all the complexity of it, but 5-year study where they included families and did a lot of psychoeducation, made a home visit. They had a 50% decrease in mortality at 5 years by including spouses.
Oh, wow.
So we know that there's the potential to really include families. So I want to go back to what you said, though, is getting information, looking at providing the family with education, but sometimes helping them make changes. Because, for example,
Having the family help for the family to help the patient make changes.
Yeah.
Uh-huh. Yeah. Well, when you're how does it work? I mean, how do you engage the family specifically? Do you invite the or do you ask the patient whether it's okay, and then you set up a time and it goes from there?
Okay. Well, there's somewhat of a long answer. I'm going to base it on really the recommendations of the group in Rogers, Susan McDaniel. But if I value family in my practice, then I want to invite families from the very beginning. It might include how I set up the internet or advertise my practice. It's how people greet the family members. Are they welcome? Let them know that they are welcome. To make sure there are physical arrangements for people to be comfortable when family members come in. Having an attitude that I want family, not, oh my gosh, this is going to make a longer visit. And then to be firm when I invite family, because there's always resistance. So I have to believe that it's important to include family, which I do believe. Mm-hmm. And so I'm not going to stop at the first excuse. Oh, for example, in pediatrics, I might see a mom and they bring up a concern about the child. And I say, so I think this would be important for us to sit down as a family, put our heads together with dad, mom, or grandma, or whoever's in the family, and see how we can understand this problem and solve it. And I say, well, he could never come in, he works all the time. But then I might say, well, it'd be okay if I call him now. And then I might call from the office right then and say, for your, would you be willing to come in for your daughter, Debbie? We need your support. So it's never like I give up. I mean, I'm not going to make it into a debate, but I believe strongly. So that's the very first thing, is to believe that I need these members in the family. And then the first issue always is when they come in is contact. I have to contact or engage each person.
And so how do you do that?
Well, it's...
So you've got this room with 3 or 4 people.
Yeah, it's called joining, okay? And I have to find something in common between me and the family. And the more different they are as far as age, race, religion, culture, the more I have to work to make sure I find something in common. I'll give you an example of somebody that I thought did a beautiful job. My dad was dying about 5 years ago when we were in hospice. I have a big family, it's an Irish family, and we had pictures up on the wall. And there were a few of us standing there, and the new nurse comes in. And my dad was sort of, not responding much, so she came over us, and instead of, she just went immediately over to the pictures, and she says, tell me about this. And she had a slow pace, and she was interested, and she got a history, and then she says, my parents also came from over here, and they went back, and she connected us on that way, and then we were like jelly in her hands. and if I'm struggling with the family, I always need to go back. One, have I engaged each member of the family, which is the first issue and an ongoing issue. I don't stop it later in the interview. And the second issue is, do I have a contract with the family to do what I'm doing? For example, and you stick to the contract. Okay, so let's say we're all going to be here today to talk about what we should do with Dad, that he's having some decline in his abilities, and our sense is we want to hear each person's ideas so we can come up with the best way to approach that. Is that agreeable? Or a very specific, and then stick with that.
And so oftentimes the contract is about arriving at a plan. Is that true? Would that be true?
And the contract is not rigid in stone.
Yeah,
I mean, I might come in and it might seem like this first, as I understand more of the problem, then I might recontract. He says, well, really it sounds like, I know we had talked about placing your dad in there, but it sounds like right now the family's in crisis and it might be more important to address this. And then get an agreement to change whatever it is.
Yeah. Well, I can certainly see that if you have a patient with a complex set of problems, that it can sometimes help to make the treatment a little more complex by bringing in the family and having them involved. That just one medical provider dealing with this very difficult situation may not be enough, and the family can help. Is that a fair assessment?
Clear, I understand that.
I guess what I'm saying is that to deal with the complexity of that patient's situation, it can be helpful to bring in the family to get a better idea of the situation and to get more help.
Oh, yeah, absolutely. And Craig, one thing it's helpful to understand is that I don't have to accomplish everything in this 20-minute session. A lot of routine is, if I find that it's more complex, what I might do is say, let's set up a family conference, which is like a 30 or 40-minute visit.
Oh, I see.
A little bit more formal, and that gives me more time for the third part of the interview, which is explore the problem, where I say, could you give me a specific example of the problem, what you've done about it? And it gives me more time for that, and also more time to do planning and get a specific way of resolving the problem.
Well, Dr. Binder, I really want to thank you for the time that you've given us today to talk about this. It seems to me to be a great introduction to this topic. It's clear that there's a lot more that we have to learn about it and that there is to learn, but I think this will be a great start, so thanks.
Well, thanks for having me. It's an area I love, and so I'm very excited to always talk about it.
Great.